Hi, everyone. Welcome to Chapter 6. So this chapter is really interesting. It's going to talk all about stimulants. So we're going to go over a few different ones. Specifically, cocaine is number one. We're also going to talk about different types of amphetamines, also a type of stimulant. And as we go through each of these different types of drugs, we'll talk about things like their history and also some different forms of each of these drugs. Get into some of the physiology of them, and then also discuss maybe some benefits and drawbacks to each of them. For stimulants here, we're really looking at drugs that are going to increase a person's awareness, general physicality, mental alertness, things like that. And there are some stimulants that are both restricted. So think of things like cocaine or amphetamine, as well as some readily available stimulants as well, like caffeine or even nicotine here. So as we go through this chapter, we're going to cover a few different things. We're going to start off and talk about cocaine first and go through some of the components of that, specifically its history, different forms, pharmacology, and then positive and negative aspects to this drug. And then we're going to talk about amphetamines here. So the history, pharmacology, and then some benefits as well. Some of the other more readily available stimulants like caffeine and nicotine, we're going to save actually for later chapters where we talk about more familiar drugs to us. So this chapter on stimulants is focusing primarily on these two. All right, well, let's go ahead and get into it. And let's start off by looking at the history of cocaine. So cocaine actually first started off being used in the Andes, and it was produced through what's known as the plant coca. So the coca plant or the coca leaves were actually where this first was used. And it was actively cultivated for over 800 years, actually, and actually ended up becoming an important part of the Inca culture. It was used in religious ceremonies and also as a form of currency, which is pretty interesting to me. So some people in the Andes still actually chew these leaves to give small amounts of coca, and it can help reduce fatigue and increase alertness and things like that. So cocaine wasn't actually used in Europe until really the last half of the 19th century. So it wasn't quite as early on and developed in that area. And so it was actually originally used as a form of coca wine. And the leaves were extracted and again also became used for things like lozenges and tea and things like that. It did also have some medical use as well. So a lot of the medical use of cocaine was derived and used sort of for this anesthesia, effect of the drug. It was used in local anesthesia for certain areas and was developed by Dr. W.S. Halsted, who was referred to as the father of modern surgery here. So again, it is actually still used even today for some small specific local forms of anesthesia. It also had some psychiatric uses as well. So famously, Sigmund Freud actually studied and recommended the use of cocaine as a treatment for depression. So we know now maybe that's not the best approach, but he was one of the proponents of using it for that medical purpose. We've obviously developed better practices now, and do not rely quite on cocaine as much, or really at all that we used to. It's also been used in medicines and elixirs. So you can see sort of the image here on the right. They used to use it in different types of medical drops and things like that. So toothache drops that actually contain small amounts of cocaine to help alleviate some of the pain associated with those small specific areas. And again, that's where we see really the most beneficial effects here coming from that acute pain relief in specific areas here. All right, let's talk about some different forms of cocaine. So one of the early forms of cocaine was actually coca paste. So this is basically like a crude extract that comes from that plant. And it's the extract of the coca specifically in a form of paste. And oftentimes this was mixed with things like tobacco, and it was smoked in that way. We also have cocaine hydrochloride. So this is basically a water-soluble solution. It's a form of salt, and this can be snorted or even injected intravenously. Then we have the freebase form of cocaine. So this is basically the extraction of cocaine into a volatile solvent, so like an ether or something like that, a vapor. And this basically results in this freed cocaine base that could be heated, and the vapors can then be inhaled. And then finally, of course, we have crack cocaine, probably one of the more common or known forms of cocaine. And this tends to be either, in both a powder or a rock-like substance. Both are actually the same substance, but just in different forms. And oftentimes this is what is smoked or baked into different things like that. Let's talk about the pharmacology now of cocaine. So the pharmacology of cocaine is kind of complex. It works in some different ways. But as you can see on the image here, when we talk about the mechanism of action, this kind of is referring back to some of the previous chapters of the first section here. But we're thinking about how different drugs are acting on this synapse or this mechanism of different medications here in this case. So what we have here is we have cocaine. You can see actually acting in this synapse and acting on these neurotransmitters, in this case of dopamine. So cocaine actually acts to block the reuptake of both dopamine, serotonin, and norepinephrine. Remember, we talked about those in the last section. And what you can see here happening in this image is the cocaine is actually going and blocking those reuptake receptors. So what you have happen ultimately is that the dopamine in this case can't be absorbed back up into that axon terminal, and instead remains in the synapse and binds over and over and over again, like there was an excess amount of dopamine. So what I actually want to do here is I'm going to switch over, and this is a really cool website. It's called Mouse Party. And what this has here actually is it's a pretty cool demonstration of different medicine or different drugs basically that people have used. And you can see each of these mice is affected by a different drug. And so what we're going to do here is we're going to grab actually the one that is under the influence of cocaine. And if I click him and drag him into the chair, what's going to happen is we're going to analyze this process and see what's really going on down at this neural level. And so if we kind of zoom in here, what we end up seeing is, like we saw in that picture, we see the yellow little dots there are the dopamine receptor or dopamine neurotransmitter. And we can see what's going on here with these little purple transporters. Those are what pull the dopamine from the synapse back into that axon terminal. And then we can see on the dendrite down on the bottom, those dopamine receptors that are actually what receive the dopamine neurotransmitter to then pass on that signal. And so this is a normal functioning process that we've seen so far. But next, if we add in the factor of cocaine, right? So what cocaine does is it goes in and it actually blocks those transporters so they can't reabsorb the dopamine in this case. And so because that dopamine doesn't get reabsorbed, it stays in that synapse and continues to bind over and over and over again with those receptor sites. And so we get this effect of increased dopamine, factors, or it appears as if there's more dopamine simply because it's not being taken away and it remains there, able to be used. Now, what we see with cocaine specifically is we see this acts oftentimes in the areas of the brain related to the reward pathways and things like that, and oftentimes as well, it factors into some of the parts of the brain that control voluntary movement. And so that's why we get a lot of people that sort of fidget or move a lot when they're under the influence of this medication. All right, so let's eject this mouse. We'll come back to this for another one during this section, and we'll save some of these other ones for some other demonstrations here as well. All right, so let's switch back over to our section here. So let's talk. We now know kind of about what happens specifically at that neural level, but how does the actual absorption of this drug happen? So oftentimes people tend to, when we're talking about coca leaves in that base form, we see people chewing on them or things like that, and that tends to have a pretty slow absorption and onset of the effects. So we don't see that quick, rapid, effect of this. It's slower. It takes time to kind of get through more of the digestive system and into the bloodstream. When we look at things like snorting cocaine, which might be more commonly associated with the intake of this drug, we see that absorbed through the nasal passage, right? And this often has a pretty rapid onset of those effects. So this is a much quicker way of getting this drug into your bloodstream. And then, of course, we also could, administer this through things like intravenous injection, right? So delivering a high concentration either into, the vein specifically, or into, other specific areas of the body. And this also delivers not only a quick response, but a pretty high concentration response here as well. And so we get pretty rapid, but and oftentimes more brief effects the faster this is introduced into the body. We also have to talk about how it's eliminated from the body as well. So it not only takes time to get into the body, but how quick it's removed from the body can show an effect on how much we see this activated as well. So cocaine tends to be metabolized by different enzymes in the blood and the liver. And it has a half-life of about 1 hour. So half-life basically means how long it takes for 50% of the medication to be eliminated or to still remain. So half of the medication is gone at that point. And so it has about 1 hour. Now, it's not saying that 2 hours later it's all gone. It's really saying that if after another hour, half of what's left is gone. So it has this diminishing effect, but it does still take time to get that out of the body. But we use this half-life measurement for a lot of different areas of understanding how long things remain in our body. So it takes time for it to get out, and it takes time to remove it. Typically, these major metabolites have a longer half-life, normally about 8 hours are more common things that we tend to see. So cocaine is a pretty quick drug to be eliminated from the body. All right, let's talk about some beneficial uses as well as some causes for concern when it comes to cocaine use. So some benefits, we've talked about these a little bit already, but the idea of local anesthesia, right? So the idea of numbing or reducing the sensation of very small, minute areas of the body. And this was used very commonly in early surgery, as well as dentistry. This was pretty common with that as well. And it's been used medically since about 1884, so for a little while, but obviously it's been replaced by some modern things more recently. We also have some benefits in regard to different surgery. It does remain in some common surgeries, specifically for like the area of the nasal passage, or even sometimes the larynx or the esophagus. So it does still have some current uses, but it is much less common than it used to be. Let's talk about some concerns, or some concerns, cause for concern here with this drug as well. So of course we have different types of toxicity. So we have acute toxicity, which basically means what are the risks short term using this drug, in a short time period. What do we have to worry about in terms of that? And so generally speaking, there's very little evidence that suggests that acute toxicity or in small amounts has a detrimental effect on health. So in that regard, there's not a lot of evidence to show that it's, has a lot of concern in that area. But with larger doses, it does have issues, especially on the central nervous system specifically, and can also lead to issues with respiratory or even cardiac arrest. So it does have some cause for concern here, even on the short-term time spectrum as well. Then, of course, we have chronic toxicity. So this is the idea of repeated use over longer periods of time, and oftentimes taken at increased doses over time to get that same level of effect. Oftentimes, this leads to states of increased irritability, restlessness, and even paranoia as well. And it can ultimately result in a form of paranoid psychosis, which is a much more heightened state of paranoia and psychological disturbance. Now, most people do seem to recover once they remove the drug and it removes from their system. But of course, this is still something that is a pretty big cause for concern when talking about this here. In terms of addictive potential, so it does have addictive properties in some users. Specifically, animal and human studies have shown that cocaine tends to be a pretty reinforcing drug, right? So it has a pretty quick response and you get that benefit really fast, and it draws people and animals to want to repeatedly use it over and over again. Also because the effects tend to go away pretty quick as well. So you have that repeated desire to use it over and over again. Now, what's interesting too about cocaine is there are some reproductive effects that have been studied here as well. The idea of sort of the crack baby phenomenon. And so oftentimes the media reports have really overstated the expected long-term effects of cocaine exposure on some of these developing fetuses. So more recent studies tend to indicate that there's really no consistent negative association between parental cocaine exposure and several developmental measures. Now, that is to say, that obviously, we shouldn't be reinforcing this or saying that this is okay to do, but that more recent studies have shown a weaker link than we originally thought. And then, of course, but cocaine use still during pregnancy has been shown to increase risks for things like miscarriage and things like that. So there are definitely some reproductive negative side effects here when talking about cocaine. All right, let's now switch over to amphetamines, which is a different form of stimulant. But we're going to go through these a little bit, talk about the history, and kind of go from there. So amphetamines originally are from the general area of ephedra, which is the general name, and was often made through a Chinese medical tea called muhang, which is again a form of medical tea in this case. And it was used to treat things like asthma, and it stimulates those branches of the autonomic nervous system that, increase that alertness and that awareness. So it's known as a can't speak. It's known as a sympathomimetic drug. Trying to read that word here. Oh, and we don't have it showing up here. So again, when we're looking at this, there are different forms of amphetamine here as well. So let's talk about some of them. So we have things like some treatments that it's been used for are things like asthma, narcolepsy, also hyperactivity in children. It's used as a form of ADHD treatment, as well as different appetite suppressant medications here as well. General use of stimulating sort of those parts of the nervous system. There is some interesting use of amphetamines during wartime procedures. So they've been given to soldiers at different points to increase their efficacy during battle or during their general performance because it makes them more alert, makes them more aware of what's going on, especially using this at sort of lower doses as well. Then, of course, we have sort of the, quote, speed scene of the 1960s, which is where it sort of blew up and became sort of a big, social drug that was used during this time point. Oftentimes it was used in combination with heroin or just, even on its own. Prescriptions during this time were really easy to obtain, and so the drug was just readily available and easy to come by in this instance. Typically, it was around 1965 where some of the laws started to change, and the drug sort of scene started to shift and looked at sort of more of the dangers of these amphetamines. So then we have sort of this return of methamphetamine, right, where we have sort of that, resurgence of this new medication, this new spin on this, where some of these harsher components and solvents are washed away. And the final stage is sort of this more refined drug of methamphetamine here, which has a stronger effect, and again tends to increase some of those effects that we see. All right, let's talk now about the pharmacology of amphetamine. So we're going to switch back over here in a second and actually look at the mouse party again, do a demonstration for one of these. But the chemical structure itself of basic amphetamine molecule is actually pretty similar to some of the catecholamine neurotransmitters. These are things like dopamine and norepinephrine. So again, the structure is very similar to the actual neurotransmitters that we see in the brain. And we're going to see, because of that, they act differently than some of the other drugs that we've looked at here in the past, because they so closely mimic what's already present in our body. So because of this structure, it also allows it to easily cross through that blood-brain barrier. We talked about that a little bit as well, that protective lining or that protective system. It's easily able to cross through that, so it is readily available in the brain. So let's take a look now. We'll switch back over to mouse party here. And we're going to take a look now at our mouse who is under the influence of methamphetamine. So if I go ahead and grab him, pop him into the chair, we're going to move over here and take a look now at some of these effects. So again, we're going to zoom in here on the brain, and we see sort of what we at first seen as a normal structure, but we see these little orange particles here appearing as well, which are actually the meth or the methamphetamine component here as well. I'll point out again, we have our purple dopamine transporters. We also have our dopamine neurotransmitters, those yellow dots in there. And then of course we have our receptor sites down along the bottom. And so you can see the meth gets absorbed up into that axon terminal because it so closely mimics that of dopamine. So the transporters are able to absorb it up in there because they don't know any different. And so what happens here is they actually start to push up into those vesicles and push the dopamine out of those vesicles and into just the general the general axon. And so because of that, these transporters don't really know what to do with all this excess dopamine that's now present. And so what they do is they start working backwards, actually. And so rather than absorbing them from the synapse, that empty space, they start pumping them out back into the synapse. So they're working almost in reverse here, which in effect causes more dopamine to be present in that synapse, able to be absorbed over and over again by that dopamine receptor. And so we can see here this increased binding that happens as those dopamine molecules bind over and over again to those receptor sites. And we get this increase effect going on here as well. And then again, we can zoom out, look at the bigger picture here of what's going on. And what we see basically is part of the reason why meth is so addictive is because it acts again on those reward pathways and makes the user or the person feel those feelings of pleasure and exhilaration, right? From that dopamine binding over and over again in those reward pathways. So we'll go ahead and eject this mouse. But again, you can see it works slightly differently. Not every drug is going to work exactly the same, but we get similar effects happening here. All right, we're going to save some of these for later. We'll come back to this for sure in other chapters as well. But let's go back now to our video or our slides. All right, so we talked about sort of the general pharmacology and structure, but again, let's talk about absorption here. So typically the way absorption happens is that peak effects tend to occur about 1 to 1.5 hours after oral injection, about 5 to 20 minutes after intranasal administration, and about 5 to 10 minutes following any type of injection or smoking of the drug. So you can see how that time course really changes based on how you absorb that medication. It takes longer for it to see an effect if you ingest it orally than if you were to ingest it through the nose or through the lungs or injection. So we talked before about cocaine having a half-life about 1 hour. In this case, amphetamine has a half-life of about 5 to 12 hours. So it's definitely a longer half-life. It stays in this body, in the system, a little bit longer. All right. And again, that was elimination. So just kind of got off a little bit. So again, half-life 5 to 12 hours, stays in the system a little bit longer than cocaine, but still not an excessive length of time. It generally is typically removed completely from your body within about 2 to 3 days of the last dose. All right, so let's talk now about some benefits or beneficial uses of amphetamine. So it has been used in the past to treat things like depression, especially in the early 1950s and 1960s. Now, not so much, but it did early on was used for the treatment of depression. Also, weight control, right? Especially talking now mid 1960s or so, was used as sort of an appetite suppressant. Again, to kind of reduce the desire to eat and have more food, and it would reduce weight that way. Let's see. So it has also been treated for narcolepsy. So that's when you just, randomly happen to fall asleep or undergo feelings of sleepiness. And this has been used to help treat this by acting as a stimulant to keep the person awake. It's also been used as treatments of ADHD. So one of the really interesting things about ADHD is that even though people with it tend to experience issues of overactivity or overexcitement, what's really going on with ADHD is that part of the brain that helps regulate that, that control is actually underperforming, right? So that area needs some form of stimulation to be able to perform better and help with the overall, control of actions and things like that. So sort of counterintuitively, amphetamine, these stimulants, help to increase those control centers of the brain, thus reducing symptoms of ADHD. So it has been used for different treatments of ADHD here as well. We also have things like smart pills. This is more of a theoretical side of this, but that it may help improve performance when people are tired or extra sleepy, like we talked about with the soldiers and things like that. However, it might actually work counterintuitively and reduce performance when you start getting to those higher doses. So we can actually see here in sort of this graph some examples of this, where we see on simple tasks like just base reaction time, we end up seeing actually faster reaction times at higher doses of methamphetamine. And so it can improve performance that way by, again, making people quicker to respond. But when their response needs to be thought out or more complex, we see that the performance is actually worse. So in that complex tasks, we see more false alarms, more incorrect responses at the higher doses of methamphetamine. So it might be beneficial for simple tasks, but it looks like it also is likely harmful in more complex tasks. Of course, then we have athletics, just the general ability to improve performance on different physical feats. All right, obviously now we have some causes for concern to discuss here as well. So for causes of concern, number one is going to be sort of this acute toxicity, right? So this is the idea of on small time frame, small windows of use, we get results of paranoia, right? That's often a pretty common effect here, especially on that short term. On the more long-term chronic toxicity, we still see that form of paranoia, but it exists in a stronger form called paranoid psychosis, right? So this is more of a, more in-depth, serious effect of paranoia. Especially when this tends to be combined with lack of sleep and even poor nutrition. There's even greater concern here for both the psychological and physical well-being of the person in this case. Oftentimes, again, paranoid psychosis is from extended, prolonged use or chronic use of amphetamines. However, there really isn't any evidence that this is a permanent, effect or factor that has happened, and that once people can remove and stay off of these drugs, that most of this tends to go away. All right, and that wraps up chapter 6. So next week, we're going to shift gears a little bit and talk about depressants. So kind of the opposite of what we've talked about here. And we'll look at how those, again, have some effect on our body and how they work from a lot of different ways.